Good morning to the doctors and also my fellow colleagues. We are from Group F, supervised by Mr. Lam. Our group have been given a topic regarding parapharyngeal abscess, which we are discussing today. This is a slide showing our Group F members, which consists of 4 people. This is the content of our slides. We have the definition, the risk factors, the clinical features, investigation, management, and also the prevention. So let's start with what is parapharyngeal abscess. So parapharyngeal abscess is a deep neck abscess that presents in the parapharyngeal space. Talking about the parapharyngeal space, so the parapharyngeal space is actually a deep neck compartment extended from the base of our skull to the void bone. Anatomically, the medial side composed of the superior pharyngeal constrictors, the levator palatini, the tensor veli palatini muscles, and the lateral composed of the ramus of mandible and also the parotid gland. So you can have a look on the pictures beside to get a clearer view of the anatomical position of the parapharyngeal space. So this space actually connects to every other major facial neck space and is divided into anterior and also the posterior compartments by the tensor vascular styloid fascia. So the posterior compartment contains the carotid artery, the internal jugular vein, and also the numerous nerves. Proceeding to the risk factors, the risk factors consist of previous history of bacterial or viral infections such as common coryza, tonsillitis, sinus infection, and also otitis media. It also consists of patients with poor oral hygiene. Uncontrolled diabetes mellitus and also immunocompromised state would also be one of the risk factors that contribute to parapharyngeal.
Moving on to clinical features. Some of the presenting clinical symptoms that you can find in a parapharyngeal abscess is painful neck swelling, fever, dysphagia, and also odynophagia. And in severe cases where the abscess is really big, you can also develop dyspnea, noisy breathing due to airway obstruction. As for the physical findings, the first one, the patient will be febrile due to ongoing infection. Patient can also present with dehydration due to poor oral intake, and you may also find that the patient has poor glycemic control. This is because in diabetic patients with poor control of their sugar levels, they are more susceptible to bacterial and fungal infection. Secondly, you will find that the patient has a diffused warm lateral neck swelling, and the swelling is tender on palpation and it is erythematous and also inflamed. And third, in a flexible nasolaryngoscopy, you will see that there is a bulging of the lateral pharyngeal wall. We may also find other sources of infection such as tonsillitis, peritonsillar abscess, and also acute otitis media. Next, for the investigations, you can carry out blood investigations like full blood count to see any raised white cell count that can indicate any ongoing infections. And you can also check fasting blood sugar and also HbA1c level to assess the glycemic control of the patient.
For radiological investigation, you can do a contrast-enhanced CT scan of the neck, in which the common finding would be a rim-enhancing collection of the parapharyngeal space.
Okay, for the management of parapharyngeal abscess, we can divide into pharmacological, surgical, and supportive management. For the pharmacological management, we can prescribe the patient with antibiotics such as the intravenous broad-spectrum antibiotics such as ampicillin or sulbactam, or ceftriaxone we give together with metronidazole. This is because the commonest organism in parapharyngeal abscess are Streptococcus pyogenes, Staphylococcus aureus, and Fusobacterium necrophorum. We can also prescribe the patient with analgesics for the pain and antipyretics for the fever. For surgical management, we can do incision and drainage of the abscess under general anesthesia, and we can send the pus specimen for culture and sensitivity, and also perform daily wound dressing to prevent infection. Wound healing can be done by secondary intention. For supportive management, airway management can be done by intubating or tracheostomy if the airway patency is threatened, and pain control, as well as adequate hydration if the patient is having upper oral intake, and also strict glycemic control.
As the saying goes, prevention is better than cure. Let's take a look on how these preventive measures reduce the risk of developing a parapharyngeal abscess. First, maintain good oral hygiene, such as regular brushing, to remove the bacteria from teeth. It is essential in preventing infections. Second, treat throat infection promptly. Upper respiratory infection, such as tonsillitis, can lead to the development of a parapharyngeal abscess. Third, avoid smoking and secondhand smoke. Smoking weakens immune systems and increase the risk of infections. Stay hydrated, drink adequate amount of water to keep the throat moist and to reduce the risk of irritations and dryness. Manage underlying health condition. For example, one of the risk factors for parapharyngeal abscess is uncontrolled diabetes mellitus. Hence, we have to manage well for the underlying health conditions. Last but not least, avoid irritants and allergens. Certain environmental factors, such as air pollution and cigarette smoke, may irritate the throat and make it more susceptible to infections. In conclusion, by implementing these preventive measures and maintain good throat health can greatly reduce the risk of developing a parapharyngeal abscess. Thank you for listening. Have a nice day.